the topic of today is not what you see there. I apologize. It's actually, do I have the right presentation? It is. So I'm sorry, it's not Bruxer screw routine crowns. It is what's going on in the background, which is an endo crown situation. So I'll take you through a case. And first, I want to review some important considerations for these endo crowns. So endo crowns, basically, we're going to utilize, I'm going to minimize this box here. All right, so endo crowns, non-vital, endodontically treated molars are where these are indicated. Premolars are a little bit too small. So we're looking at endo-treated teeth, lacking coronal tooth structure, and we are looking for tooth surface for us to bond to. It's all about surface area for us to retain our restorations. And so when we lack a large portion of the coronal tooth structure and the tooth has been endodontically treated, we now have the root canal space, the pulp chamber to allow for our restoration to come into contact for retention. So molars are primarily where we're going to do this. And I say primarily, really with the system, you're really going to want to focus on molars. Premolars are just kind of out of the question because of how narrow the pulp space is. Traditionally, we looked at casting metal posts into that zone, or nowadays, more so, we're seeing fiber posts utilized for that purpose. Unfortunately, milling into that canal space for premolars is very limited and challenging for the system. So you're not going to get the results that you're hoping for. But molars, good spot. So as we mentioned, loss of coronal tooth structure, and on these endodontically treated teeth, we have space now for internal retention. The pulp chamber is used as the primary retention zone. You do want to make sure your standard restorability, as you would with any fixed restorative case. What is the periapical health? Is there any concerns there, need for retreatment, getting that addressed first? Significant bone loss due to periapical or periodontal issues. So evaluating that is important. Where the margins are, where the finish lines are terminating, whether or not there's biologic width invasion, and that can certainly complicate the process. Evaluate for fractures. Vertical root fractures certainly are a big contraindication for most restorability. Periodontal health, evaluating for any major movement or periodontal pocketing. Furcal involvement. Traditionally, it's considered class 3 furcations typically are contraindicated to restore. That's basically like a through and through furcation where it goes through. It may not come through on the other side because of gingival blockage, but just a little bit of furcal involvement, it's okay. You know, it's all about cleanliness. Are we able to maintain cleanliness along that tooth structure to restoration complex? We're going to prep for adequate material thickness. The next slide, I'm going to review some important prep guidelines that we want to consider for these endo-treated restorations. Occlusion. So in a situation where we've lost a lot of coronal tooth structure for ultimate strength for the restoration and tooth complex, we want to think about minimizing or certainly for patients that are in heavy parafunction, do you want to consider even going this route to restore? If you do restore, how are you going to protect the teeth? Prescribing a night guard can certainly be a good modality. For the design of the restoration, you want to minimize any excursive contacts. Teeth, restoring teeth, natural teeth, implant restorations, all dental related restorations that we do are strong mostly in compressive forces, so downward forces down the long axis of the tooth. With these endo-treated teeth, depending on, of course, your bonding protocol, certain situations, well, these situations in general are unfavorable when there's a lot of excessive lateral forces. So I'll show you in the design how we can minimize these excursive contacts and where we would want to do that at. Material selection. So for these types of cases, the majority of my endo restorations are CAMouflage. I do them mostly in CAMouflage. The next most used material for myself is Bruxer. And the next final restorable or restorability material would be obsidian. And for myself, obsidian is farther down the list because of the additional processing that's required. So for partial coverage cases and these endo cases, CAMouflage is my personal go-to. This is kind of personal preference. Which material are you more comfortable handling and are more comfortable with the bonding protocol? Because the next really important consideration is you have to adhesively bond these in. Are you able to maintain the right isolation, minimizing any risk of contamination? Are the margins really set subgingival? Can you maintain that clean field? And again, the technique sensitivity of each bonding protocol, what are you most comfortable with and have had the most success with? According to the literature, a lot of endo crowns are treated primarily with lithium disilicate, so EMAX type restorations, where the obsidian is in that category as a glass ceramic. It has really reliable, repeatable bonding protocols. It is plenty strong. You got a tremendous material thickness in the majority of that restoration with these endo restorations. But some areas of concern and where failures do happen are when maybe occlusal excursive contacts are not really taken into consideration, or certainly where the material thickness is compromised. So prep guidelines for these, margin design, we're looking at a butt joint, sharp cable surface finish line, or chamfered margins. These endo crowns can take on a variety of different margin appearances depending on where the lack of coronal tooth structure is. I'll show you what I did on a couple of cases in a minute. If we are able to maintain margins supragingival, then that is certainly a favorable position for that finish line. I know it's not always possible, especially when we lose a lot of coronal tooth structure, or if there is an existing restoration that was already starting off sub G. The amount of depth into the pulp chamber, we're wanting to have enough material thickness and certainly bulk of material for retention through that zone. So we're looking at 3 to 5 millimeters of depth down into that pulp chamber, basically down to the pulpal floor. And once you've reached the pulpal floor, you really, if the roof of the pulp chamber is not fully uncovered, you want to open that up. So the very bottom of your preparation down where the pulp chambers are, or excuse me, the pulp floor, and basically from canal to canal. So once all of the canals have been uncovered, you basically want those areas to be connected and smooth down at the base, and that'll serve as your base or footprint. So you want to widen everything down at the base. And then really from that point upwards, you want your walls to kind of diverge. So widen from bottom to the top. So that's the next point, divergent internal walls. So down from pulpal floor up to the coronal area, you want those walls to diverge, so widen near the top. Any coronal tooth structure that might remain, which in some cases there's a combination of remaining tooth structure, anything in the coronal portion, as you would with a normal indirect preparation or crown preparation, you want the walls to converge. So kind of above ground, supragingival, you want them to converge. Below ground, you want them reversed to be divergent, just thinking about like a large inlay. The amount of occlusal clearance, because we really want ultimate strength in these restorations, adequate material thickness, we're looking at to establish if there is coronal tooth structure left, we want that to be about 2 millimeters away from the opposing for optimal thickness, and of course, that leads to optimal strength. Rounded line angles. So any transitions internally, externally, really any sort of transition in your preparation, we want those line angles to be rounded. Rounded will allow for better adaptation of the restoration to your prep as best as you can. You know, I'll show you on one of my preps, there's some areas that are still maybe consider a little bit sharp, but as best as you can. We're wanting to provide access for the burr and ultimately allow it to just kind of blend and have an intimate connection and fit to our prep. So this I got from this study where they looked at the morphology of the pulp chamber. So this was really, really nice, just getting an idea of the variety. I believe on top we've got mandibular first molars. On the bottom we've got mandibular second molars. And certainly there are many, many more, I'm sure, beyond these. Kind of depends on the number of canals and where those canals. Again, once the canals have been identified, that serves as your base. And so what you really want to do is once the base has been established canal to canal, you want those transitions to be nice and smooth and opened up. And from that base upwards, using a large tapered burr, diamond or carbide, doesn't matter, the tapered nature of it, you just kind of want to allow for the walls from the base of the pulp floor to just widen up and widen up smoothly. And then once you do reach the coronal portion or outside of that pulpal space, you want those transitions to be nice and smooth and flowing and rounded. So this is the case that we're looking at. This is number 19. Patient came in with the crown missing. So endodontically treated, it was restored with the crown before, but as you can see, lost the restoration. And from a buccal view, you can see a good portion of the coronal tooth structure was lost. There was probably a post, probably a buildup. Patient didn't have the crown with them. And of course, like I believe most patients, they will certainly rather restore and keep whatever's left of their tooth, keep the tooth rather than jump straight to an implant. The implant option, we do implants very often here, but only when necessary. And I love being able to try to save the teeth if we can. So what we're looking at, again, restorability, where would the margins terminate? Is there biologic with invasion, periodontal health? In this case, patient's health was good. There was no periapical issues or pathology. And there was a little bit of soft tooth structure, some recurrent decay. So we want to remove as much as we can and then determine where the sound tooth structure remains after that. So through the preparation, we're always using round-ended tapered diamonds in our clinic. That allows for where the tip of the burr comes into contact with the tooth structure, at least those zones are rounded. Here, these extensions coming upwards, you have to be a little bit creative, maybe turn the burr sideways, or maybe a football burr, round burr can work really well through this zone. Here, the margins are kind of equigingival, getting to subgingival. Go ahead and pack a size 2 cord in, let that sit. While the cord's sitting, you can kind of, here I'm going through and removing some soft tooth structure with a slow speed carbide round burr. So I think we're at a speed of about 3,000 RPM, not too fast, just letting the burr, this does a great job of removing soft carious tooth structure. And of course, it's not shown here, but if you do have caries indicator dye, that pinpoints where the demineralized tissue is, because you really want to try and eliminate as much of the demineralized tooth structure as possible, because we want nice solid tooth structure to be able to bond to. So just looking at the preparation once again, from the top down, thinking about the prep as a bowl. Here, there was very little coronal tooth structure left. So we are fully utilizing that canal space. And after removing all of the soft tooth structure, you can see it's really wide. The base of this is even wider than just that pulpal floor. You know, at a minimum, you want your base of your restoration or prep to be where the canals are located. So you can see those 4 canals there, at least in that zone, but here it's widened a bit more. And I'll show you in more detail once we get to design, and you can check that out. But thinking about like a bowl, it is like a bowl. So wider at the top and narrows toward the bottom. If you can visualize all of those internal walls, as with any good CAD/CAM indirect preparation, minimizing undercuts, that's also preferable. The finish lines I have at butt joint on the lingual, on the distal, On the mesial buccal, there's where there is a little bit of coronal tooth structure kind of coming upwards. You can see it's more of like a chamfer type preparation. So round-ended burrs are going to create that type of transition. So it's not necessary to make a butt joint all the way down. That would really entail flattening all of the tooth structure around the margins. So that's not really necessary. So anywhere there are vertical areas of your preparation, you can think of that zone as like a traditional crown prep. You can see here on the distal lingual area, that zone, the margin is kind of getting really, really low. So any areas where you notice your prep really going subgingival, you probably want a bone sound and just kind of verify that you're kind of getting into a safe space or still within the safe biological width zone, about 2 millimeters. All right, so I have a video of the design, but I'm going to show you the design here. All right, so once we open the case, as with any single unit full coverage preparation, the software will implement the margin AI. But because this prep is a little different, we'll have to do some modification to the margin. So usually I'll just find a spot and just work my way around the margin. So let's just start here on the buckle. So you can see here, again, it's kind of like a light chamfer on the buckle here where this vertical portion, whatever remains, is. So we're going to bring the margin and bring it right to the edge there, and we'll work around clockwise here. So I'm going to increase the size just a little bit, and we're going to go ahead and, again, just work the margin to the edge. So I'm getting a little overextended here. I'm going to bring that up. Okay, so going along the mesial zone, so we can see right where the tooth structure is getting close to see where the hard tissue is getting close to the soft tissue, just right to the edge here. Mesial lingual, let me reduce the size a little bit. We're going to tuck this in. It was overextended. Now we're going to bring it right to where the tooth is. Right to the edge again here. I didn't talk about it during the prep scan, but prep scan, of course, making sure you've captured, you want the field to be dry as possible. It definitely enhances the scanner's ability to capture the field most accurately. This is that distal lingual zone where we're kind of getting subgingival, just following where that tooth structure goes. All right, right along the distal here. And for these kind of challenging preps where the margins are getting close to equigingival, really close to that tissue, I also like to, a couple of things that we can do. You can always turn on, turn off the color, turning on the stone or monochromatic view. I like this in combination with the curvature function. This curvature function, it highlights edges on the prep. It can be a little deceptive though, and I'll show you what I mean by that. So I'm going to turn off, what I also like to do for these challenging situations is toggle the margin on and off. So on the lower right-hand side, there's a checkbox next to margin. And sometimes with the margin there, it might block your view, it might look correct, but when you toggle it on and off, it might reveal areas that may not have been as obvious with the margin on. That you may need to make some minor adjustments to. So usually I'll toggle on and off. I'm just following kind of the same path during that initial editing. And if there's anything that stands out as being overextended, underextended, anything that just kind of jumps out at me, then I'll kind of move it there. Now, this is where I mean where the curvature could also be deceptive. Now you're looking at this strong, bold, highlighted area on the inside of where the margin currently is, but that is where the tooth structure is extending upwards. So keep in mind, if you are using curvature, the curvature is just simply the software highlighting edges on the model. So it's whatever's sharp, and the sharpest area kind of wins in terms of the highlighted appearance. So you'll see the cusp tips are highlighted, the edges of this is kind of what I was referring to, maybe a sharp corner. I didn't want to lower that anymore. I just rolled over it to soften the sharpness a little bit, and of course, removing the soft tooth structure. But that highlighted portion is not actually where the margin is. That's kind of the transition point from the coronal area outside, coronal tooth structure, and that transition into that root canal space. So I'm going to keep the margins where we are. You can see when there's not super great retraction and a super sharp finish line, it doesn't highlight it very, very clearly. But here I have the margin just a little bit past. I can see where the tooth structure meets the soft tissue, and that really is a very good indicator. Okay, so that is the margin. I'm going to turn off curvature. Let's go back and look at the color. Color is also certainly, I know I turned to stone. I initially did the editing here, but a combination of color and stone, I like to use both. And of course, the color, we do know the benefits. It does show that contrast between the hard and soft tissue. Okay, so let's go forward into design. And once we go into design, the software will generate a AI proposal, as it would with any single unit posteriors. Multiples, not yet. If you wanted to see AI, you have to navigate to the proposal section and activate it. But it should automatically generate the initial proposal with AI. And because of this being an endo crown, so we have a non-traditional crown preparation, traditional prep, kind of like a top hat, like it comes upwards. We all are familiar with what that looks like. But because of the endo nature of this, the algorithms are not quite refined for these situations just yet. We are reviewing these cases. The software team is looking at ways to better support these types of cases. And so you can see what happens with this initial proposal. This is usually the appearance of endo-treated teeth. We've got kind of lumpiness going on. It's because of the math that's taking place as it's adapting into that internal space. So you can see the software, it does adapt the restoration within the tooth. That's not a problem. But as it's doing that, just kind of the difference between this endo type of preparation and what it traditionally sees, there's just some lumpiness going on. So how do we address this? Of course, we can use tools and smooth this out and modify it. But I tend to just change the AI over to change the AI proposal over to the library proposal. So how do we do that? Let's take a look. And we're going to navigate over to the left column. We're going to go to the first icon for proposal. And inside of proposal, there's a drop-down menu. We're going to change from AI to library. If we had the contralateral side scanned in, we could also use the mirror design, or if we had a pre-treatment option, a wax up, or if the preoperative tooth, let's say, even if it came off, if the patient had it, we could maybe seat it into place and scan that and have pre-treatment copy as an option if we wanted to copy the original contours. But in this instance, we just had the prep, the remaining tooth to go by. So let's go to library. Library, I think, is going to serve as the best option. And I always recommend in our classes, you'll often hear we review library as always the backup. It's kind of like driving with traction control off. There's no safeguards taking place. Contacts aren't done. But the starting point is a nice looking design. We have our generic library contour here for lower left first molar. Let's turn the model back on. And we just have to manually position this into place. So this will be a good review of library. I'm going to just pause for a second to see if there are any questions.
There are no questions in
No
the Q&A
questions.
box at this time.
Thank you, Leah. Okay, so once we turn on library, the next thing, we could actually just start designing from here, but library also gives an additional option where you can make adjustments to this initial starting point for library. So we're going to go ahead and hit adjust on the bottom of the window here, upper left. And we have, this takes us into this section called arch mode, where we can modify the starting size, starting position, and angulation of this library tooth. So I like to usually start off with size. And sizing this up, usually it starts off pretty close, sometimes smaller, maybe sometimes larger if there's a missing tooth. So you basically want to size the tooth to the ideal size of this restorable or restorative site. So we have our mesial distal limits, right? We know how wide this is supposed to be. So we basically just widen it until we bump into the adjacent teeth. Buccolingually, we have the margins as a point of reference. So usually we're going to go to about where the margins are. And it's okay if you see the margins kind of hidden, because usually where the margins are at that depth of the tooth, usually that if the circumference is smaller than the coronal portion. So usually the whole crown will cover it. So seeing that the crown covers the whole prep is about where we would want that to be. And so we get it to the right mesial distal buccolingual proportion. So the size is basically dialed in. Another size adjustment could be along this vertical plane. So you can also change the size this way as well. But generally, we just want the size of that tooth or height of the tooth about, first of all, even with the adjacent teeth. But there's also a second consideration would be the opposing dentition, which is indicated by that red zone that you're seeing on top on those buccal cusps and a little bit on that distal lingual cusp. So is the goal to have red, get rid of red? Red is really just telling you that we're kind of bumping into the opposing. So we want red, just not too much red. So you can see we lowered this down a little bit, and that relieves some of the tension or some of the heavy occlusion. We could lower this even more to just a little bit, but you can see how it kind of drops the whole occlusal table much lower than the adjacent teeth. So we want this to be about even with a good amount of occlusion. And later on, when we refine these contacts, we can show you how we get that dialed in specifically for this case. So that was size. The next thing would be the angulation. So angulation, this is defining the long axis angulation. So from this buccal view, you can see how this arrow kind of gives a good indicator. It's kind of leaning toward the mesial. Natural curve of spee as we go from anterior to posterior. We typically have this natural inclination from anterior to posterior. We can kind of see this illustrated really nicely here. If we look at a grid here, so anterior to posterior, that's that curve of spee in place. So we want for, if we're taking an imaginary line from mesial to distal, we want for the plane, the occlusal plane of the tooth we're working on to generally be kind of straight across. So some, maybe more so something like this. I'm going to angle this a little bit more vertically. So that's now the new long axis angulation. So that's along this plane. Another plane that you really need to consider will be from the mesial or distal. So from this mesial view, we're looking at, does this long axis angle kind of match the adjacent teeth? So we can kind of use the buccal surfaces of the adjacent teeth as a point of reference, also the occlusal table of the neighboring teeth as a point of reference. Does this look in harmony with those teeth? You can see the adjustment using that same occlusal sphere. We can rotate to the buccal, rotate to the lingual. We just want this close to the adjacent teeth. Again, using the adjacent teeth as that point of reference. You can look at it in this case from the distal as well to see how we're aligned. And one final thing, actually, there's a couple of things. So that was the angulation. We started with size, then angulation. The next thing is the general position. So is the position centered over the prep? So you can see we can simply just grab the tooth and center it. Also, we can adjust the height by clicking on the tooth up and down. So we started off even with the adjacent teeth, that's pretty good. And centered over the prep. The final thing, as far as positioning goes, looking at the opposing dentition. So it's always a good idea to just kind of double check, how is the opposing teeth adapting to our restoration? So generally, you can always use the adjacent teeth as that point of reference. What is this patient's occlusion like? This is what we would consider normal occlusion, where the upper teeth are more buccal to the lower teeth. So you can see how the buccal cusp of the lower premolars, they go into the middle of the opposing. And Same with our second molar. You can see the buccal cuff going into the middle, or the fossa, central fossa of the opposing. We generally want the same thing if the opposing teeth of our restoration are kind of in that same alignment. We want to establish a similar type of occlusion. And so what I mean by this is we don't want the design to be too far buccal like that, or too far lingual. So in this case, having it centered over the preparation was a good location. Looks like I lowered it a little bit too much because indicated by no occlusal contact. So we do want occlusal contact. And we verified that we can even look through the opposing. We can see that those cusps are kind of coming into the middle area of our opposing. So that's pretty good occlusion and a pretty good starting point for our design. So I like to just start over to that original view, bird's eye view, just making sure the tooth is centered between the adjacent teeth, centered over the prep. And let's go ahead and hit apply to establish this as our design's starting point. So you can see from that point, when we hit apply, the software will automatically adapt to the margins, and that's it. It doesn't set the contacts, it doesn't set the occlusion. So now we still have to evaluate those zones. And we'll start off by trying the automatic contacts in the contacts window first. And if there is a need for additional adjustments, we'll go through that. So let's try this first. We can actually see, we can pick up some information, the initial starting point of our contacts. You can see there's a distal contact, but notice how we don't have a mesial contact. The software didn't see a contact on the mesial. Also, there's no number here. If that ever happens, I'm glad this happened, but if that ever happens, I can now show you how to establish that contact. So what we're going to do is on the bottom of our contacts window, we're going to go to Edit Mesial. So that'll take us to a straight-on view of, in this case, number 20. You can see that indicated on the button, number 20. And basically, for whatever reason, the software didn't recognize that neighboring tooth as a viable neighboring contact. So we're going to go ahead and draw a contact area. So that's what this edit mesial, edit distal spot allows us to do. Now, I don't want you to just start off randomly drawing the contact. So to do this, you just left click and hold and draw a contact. So you might say, hey, I want a really broad contact here, and we'll highlight a nice broad contact. And then when you apply the contact, essentially what happens is the software is going to adapt this design to your drawn contact area. Now, if we look at it from the top, you're going to now see how this painted area starts to wrap around that neighboring tooth. And that's not what we want. Natural teeth will just butt up against the adjacent teeth. And typically the contact area is not very, very large. So I know we all love broad contacts. I'll show you how we can get the broadest contact that is both hygienic and should also serve as a good way to minimize any food traps. So I'm going to go back to here. I'm going to move the color off for a second. What I like to first evaluate before I draw the zone is, let's look at it from a bird's eye view. Let's get an understanding of what part of that neighboring tooth faces our preparation. So we know the cutout area is our prep. So if you really look at this neighboring tooth, it's really from this zone here on the buccal, on the distal buccal, to about here on the distal lingual. That's about where our contact is going to occupy to have a nice convex surface on our design, flat to convex. Beyond that, if we extend it more buccal or more lingual, our design begins to wrap around that neighboring tooth, and that creates a challenging hygienic situation. It's really hard to pass floss through it. It's really hard to brush away in those embrasures. We want for the design to kind of begin flowing away from the neighbor where that adjacent tooth is flowing away. So now that we can understand that area there, we can also utilize the reflection in the software. Notice how right here, that basically highlights what part is facing that preparation. So now that we have that understanding, we're going to basically try to concentrate our drawn contact in this highlighted area. So while we talked about buccolingually, how far buccolingually we're going to go, we also have to consider how low we're going to go. So notice how below this point, notice how the reflection, it just kind of disappears. So we don't that's basically where the tooth is sloping away gingivally. So we also don't want the design to go into this space either. So we're going to maintain kind of around this zone. Now that we know about the size of the contact we want, are we going to draw it exactly, our oval to match exactly what this reflection is? We shouldn't. If we do that, the software will also begin wrapping around the neighboring tooth. So we're going to make this drawn contact a little smaller. So I'll show you here. I'm going to just make the oval a little smaller, something like that. And we can also see from the top that just kind of occupies really well, really nicely. Maybe we can go lingual just a hair. So let me do this one more time. If you ever mess up and want to start over, it's okay to just simply start redrawing it. And let's try that. It might be a little low here, but I'll show you how we'll evaluate it afterwards. Let's go ahead and save it by clicking the check mark on the left. And that was the mesial side. Nothing happened yet until we hit fixed contacts. But you can see after drawing the mesial side, we now have a contact value. So now we woke it up and said, hey, we have a contact, a tooth here. Now it's showing we're 40 microns away, or an open contact with the mesial. Let's go to the distal. Let's take a look at the distal side now. I like to go through both checks first. Even if there is a red zone drawn, I'll just go ahead and hide it for now. Let's take a look, bird's eye view. We've got a nice broad area here. And you can see where the tooth begins flowing away. This is going to be a nice large contact against this distal tooth. So probably something like this. The highlighted area is about where we would want to adapt our contact to, not much more buccolingually or lower than this zone, and also not above it either. We have an occlusal embrasure that we have to consider. So if we're going to draw our contact, we're going to draw it something like this. And we'll accept it. And so now we've set our contact sizes using edit mesial, edit distal spot. We're going to verify our contact values. So the material I mentioned earlier, I typically do CAMouflage, which that is what I prescribe for this patient in the treatment plan, CAMouflage crowns. So for our CAMouflage crowns, we're setting our contacts at the default values from manufacturing. We've got 30 on the mesial, 30 on the distal, and minus 200 on the occlusion. So those all look good. So we're going to go ahead and hit fixed contacts. And now the software is going to adapt those surfaces to those drawn contact areas, and also any areas that were heavy, it also takes that down. So that looks really good. Now, you can see what happens on the distal. Notice how it sort of started sneaking away. I kind of maybe brought that drawn area a little bit to the buccal, too much. So any area where you notice some hugging action taking place, you might want to smooth away that zone. So I'm going to do that here. You can basically see this concavity now. It's kind of this bowl on the distal surface. So to eliminate the wraparound effect, we're going to go to smooth. I'm going to use the smooth tool, maybe bump up the strength a little bit just to speed things up. I'm basically just going to go around the corners. I'm taking away the part that's beginning to hug the neighboring tooth. That looks a little bit better, maybe a little bit here, a little bit here. So that's what I mean, the risk of overdrawing your contact area could lead to some hugging. It could also hug down at the base. So I think it's a little low as well, because we don't want material sneaking into the undercut of the adjacent tooth, which would make seating this restoration more difficult. So you can see after smoothing it, it's more of a convex surface. It's not wrapping around the adjacent tooth quite as much. It allows for easier cleaning, passage of the floss, passage of the bristles, hopefully, when our patients are brushing. And also another thing are these kind of open occlusal embrasures. We want to see, we don't want it to have a contact all the way to that marginal ridge. Having these areas a little bit open is also beneficial. It allows passage for food, and of course that V-shaped embrasure makes it easier to set the floss into. All right, so that is our design. So that's pretty good. So in normal occlusion, we want to have, and again, we're talking about endo-treated teeth. Most restorations, but especially with endo-treated teeth, we want the contacts to be concentrated in normal occlusion on the buccal zone and maybe in the central fossa too, because when the patient bites, the forces are directed more downward in more compressive forces. We want to limit the amount of lateral forces in most cases. So if I saw contacts on these inclines here, I might want to lower those down. But I'll tell you some additional occlusal contact adjustment I will do here is just simply lower these non-functional cuffs, because I don't want for when this patient may be going into, um, let's see, it would be left lateral excursive movements where the uppers are going to pass over these cusps potentially. I would kind of want to minimize that. So what we can do is either we can use freeform, maybe increase the size of freeform, and just simply lower these cusps a bit. If I'm looking at the adjacent teeth, generally maybe a little bit lower than those. These are the non-functional cusps, so the patient's not going to really lose any chewing efficiency. But how can we increase chewing efficiency? We could possibly, I'm going to go back to freeform, possibly raise this central fossa area. Let me just see what happens. I'm going to raise this up. Raise this up. And so now we look at the occlusion. So now the forces are concentrated. It's still somewhat in the middle. It's on the buccal cusp, downward into the prep here, downward into the prep. That's basically what we want. I'm going to see here, a lot of times you may hear about trapezized occlusion. I'm just going to see, can I bring this? So see, we can bring this distal buccal cusp kind of into occlusion too. So that's the occlusion that kind of starts to hug that opposing cusp from the from number 14. So that's a pretty balanced occlusion. Avoiding contacts on these non-functional inclined planes, certainly on the cusp themselves, which would be hard to do. You'd really have to pull that design inward. But we lowered it. We reduced the risk of any excursive lateral forces bumping up against these non-functional cusps. And we've also enhanced the occlusion a little bit, just giving a little bit more vertical application of force into the tooth. So that's about where I would leave the design. So I'm just going to get another bird's eye view here, checking from the lingual, checking from the buccal, if there's any contour changes. I like to check down the buccal corridor. Does the design kind of match the appearance of the adjacent teeth? We could actually do this, have this be a little bit more similar. You can see how this patient has naturally, these are all natural teeth neighboring, this natural kind of mid-buccal bulge. Same on the second molar. So if you wanted to kind of mimic that too, you can enhance your design to include that. So using freeform, I'm just kind of clicking on the mesial buccal cusp, just kind of simulating that same change. I'm doing it now. I'm thinking back to when I did this piece. I didn't actually do this, but this is just one additional thing that you can evaluate for to get your restoration to fit the neighborhood a little bit better. So that is the design. I'll show you one more thing you want to evaluate before you send this off to the mill, and that would be the insertion direction. We're going to go to the insertion direction by clicking on the margin window. So left column, third icon down is our margins. And once the design has been generated, on the top tab here, we have milling and insertion direction. We're going to give that a click. And this is showing you the insertion direction. How is the restoration going to drop into your preparation? And also this determines how the restoration will be milled. So you can think about this green arrow as not just the insertion direction, the path in which the design is going to, or crown is going to drop into the prep, but also that green arrow is the burr. So I'm going to turn the restoration on for a second. You can kind of think about this as, again, the burr, having that burr adapt to the inside of the restoration. How is it going to cut the inside of the restoration? So it's the approach angle of the burr to the inside. So how it cuts the inside is going to determine how it drops into place smoothly onto your prep. Now, what should we be looking for here? So the software by default, it minimizes undercuts in the prep. That's kind of how it's currently written. It's looking at the prep mainly and calculating the position that is the smoothest straight down onto the prep. So you can see into the walls, if there were any undercuts, you can see it highlighted by a little bit of red there. So you'll see that red. And if we move this, you'll see eventually there's going to be more red forming in a certain zone because basically, since we're moving it to the buckle, we're telling it we want you to insert the crown or mill it so that it inserts from this buckle position. But you can basically see where you're viewing from the insertion or viewing from that insertion position, there's areas that become hidden. Those are the undercuts. All right. Now I'm going to go back to the auto position. That's where we started. Now, when I say it currently calculates only the internal connection, the part that it doesn't evaluate yet are the adjacent contacts. So you'll see contact windows, or excuse me, undercut curtains, which I call these red zones here. That is the undercut based on the current insertion direction. So what I usually look for here is I like to kind of even out the contact surfaces of the adjacent teeth. So you can see here, we see a lot more of the distal surface of the mesial contact and not a lot of the distal tooth. In this view, we can see more of the distal tooth and less of the mesial contact. I like to try to even those out if possible. So kind of looking straight down to where this view is not favoring one way or another. So that's the mesial distal axis from a buccal lingual. Also, just considering a bird's eye view of the preparation. And that's where I idealize my insertion direction. So once I'm viewing from this view, actually, I'm going to go buckle just a little bit. Once I'm viewing from this view, I'm going to double left click on the milling and insertion direction. And that just kind of balances things out because I was able to factor in the adjacent contacts. So just to kind of expand on that a little bit more, if it's angled too much to one of the neighboring teeth, you'll see this undercut form. And so when the undercut is really large over the adjacent teeth, what can happen is if your design goes within that undercut, it's going to be a little bit more work to get that to seat. The risk of having to adjust that contact just because the path of insertion is, in this case, we're telling it more of a mesial inclination. So that undercut is potentially going to affect how smooth that restoration can seat into position. I hope that wasn't confusing. I know it's a little bit of a confusing topic, but insertion, just think about the smoothest path for both the prep and the adjacent teeth so that your design has limited interference with those neighboring teeth. Okay, so I know I made the adjustment to the insertion. Let me just review that one more time. Top down over the prep looks pretty good. Evening out those adjacent contacts, not too much distal, not too much mesial, kind of straight down, and then we're going to set it right there. So to preserve the insertion, and we're going to close X out of the box on the left, and we're going to, the software is going to apply these changes. It basically modifies something on the way the inside adapts to the prep. That's really the big change that occurs when insertion is adjusted. So we're going to hit OK. We're right back to our design. You can see, I didn't notice this earlier, it was minus 170. We're close enough from the opposing. If I wanted to get it a little farther or close to that minus 200, I can smooth away some of the material here. And we're back to minus 200. So 30, 30, minus 200. Before hitting send to mill, for the materials that have optional sprue positions, I like to first run view nesting. Really, all of them do now have multiple material, or excuse me, sprue positions. So this is CAMouflage, and Obsidian. Biotemps have the most. We're going to go ahead and confirm. So to do a sprue adjustment, we're going to run view nesting. we're going to generate our simulated milled crown first. And once that generates, then the software is able to calculate how many additional options there are for the sprue. So you can see the initial sprue position, distal lingual cusp. Not bad. I'm okay with that. I know most of you probably want it on the lingual side. Let's just see what options there are. I'm going to activate sprue position on the left, second from the bottom. You can see we can go all along here on the distal lingual, also mesial lingual, and a whole band on the buccal as well. So I know, I think it's due to hiding any maybe residual sprue. That's why most of you will choose the lingual. And I'll admit, I also am a lingual-sided sprue person myself. So we'll go back there. This little minimal thickness spot, if that is of concern, which in most cases we do want optimal material thickness, you could always go back to, let me exit the sprue position. And we can either use a tool to bump that up, or if you return to your contacts window, if you use protect thickness, the software should automatically seek out any thin zones and just bump that out. Very minimal addition of material. So that is the design here. Let me go back to the presentation and we can look at where we ended up with this case. This restoration milled extremely quickly, which is one of the huge benefits of CAMouflage, milling in 10 minutes or less. And you can basically see you have like a reverse prep. Your inside cavity now becomes the vertical extension of your preparation. And let's see here. So just a couple more views of that milled restoration. We do have to bond this in. So what we normally do is we're going to go ahead and try this on. Really beautiful fit. I think CAMouflage, if we really were to do a test of CAMouflage or all the materials on the same types of cases, CAMouflage, I think, adapts the nicest. The other ones are not far off, but I think CAMouflage just adapts the nicest. So, which is one of the other reasons I like to mill these out for these more unusually shaped preparations. So we try on, great fit. And after we tried on, to pre-treat the material for bonding, we have to bond these in. We air abrade it. So air abrasion with aluminum oxide or sandblasting with aluminum oxide, 50 micron aluminum oxide. A little tip for you, something that we do is, I know it's not shown here, we're going through the bonding. When we air abrade, before we air abrade, we'll take a little Sharpie and just kind of mark all the way to the margins, just kind of all the different surfaces. That way, the game becomes air abrading or sandblasting away all of the color. That's a really good way to determine that you've effectively sandblasted the entire internal properly. Because otherwise, it's if you're just looking for matte surfaces or just basing it on passage over a certain zone, it's a little bit unreliable at best. So I like the sandblasting away the color. Once we sandblast away, we're going to rinse and clean any excess residual aluminum oxide that might remain, just so you have a clean surface, and dry it. And now we're going to apply our bonding agent. The bonding agent gets infused. We're relying on this micromechanical retention to enhance the bond. We use a universal bonding agent, 3M Scotch Bond Universal. There is an additional silane that's embedded within the chemistry that will chemically adhere to any of the glassy matrix on the CAMouflage. So that's an additional benefit to using a universal bonding agent that contains silane. So we're scrubbing that on, and just a nice thin coat, getting that to adapt to our air abraded surface. And we're going to air thin that out. Sorry about that. We apply it with our micro brush. We're going to air thin that zone. You can see we have our light protection here. We don't want this to pre-polymerize. We air thin it. You can polymerize it if you want. Otherwise, if you're worried about film thickness, you can also wait. Depending on your cement systems, it should bond, or you should have access to cure it through the restoration. It's plenty translucent enough. So just going back to the tooth side, I like to total etch. I went to USC, studied under Pascal Magnier, big biomimetic guy, bonding guru. total etch. Total etch really is shown to provide the best integration and formation of a hybrid layer on that etch, dentin, and enamel surface, as we know. So after we etch, we're going to rinse that off. We want to basically remove the smear layer. And now I'm really scrubbing in our bonding agent. So Scotch-Bond Universal that we're using here, scrubbing it in, really intentionally getting it in contact. Here I'm using a skinny brush, just especially along the margins. I don't want to potentially contaminate or pick anything up from the tissue into the prep as best as I can. I know we're not under perfect isolation like many will consider. We're using an IsoDry here. And so at the time of this delivery, we were using 3M Reliax Ultimate, that is 3M's adhesive resin cement. So I applied it to both the restoration and within the prep cavity, and we're seating it down. Firm pressure, a little bit of excess bleeds through, which we do want to see. That way we know we have, hopefully, usually indication of a good seal. And we go through our tack cure. So we'll tack cure, remove the excess. You can also wait for it to set up and begin gelling to remove the excess. But now we're going to go through, remove as much excess. I like to just a quick tack cure, 1 second. Most manufacturers will say 2-3 seconds, but depending on your light, depending on how far you are and angle, that can all vary the amount of set of the cement. So whatever you prefer, but you have to use an adhesive protocol, regardless of what material you're using. Because of the more non-traditional, non-retentive situation. When we bond, a term that's often used in the bonding and adhesive dentistry space is a monoblock formation. When we bond, we're relying on micromechanical retention and for forces to be applied on the restoration, and it serves as a single unit. So that's what we're hoping to achieve through a sound bonding protocol, good adaptation of our restoration to the prep. There I was using, after we bonded everything in, I was using the polishing kit. So of course, checking our occlusion, minimizing, reducing any heavy spots. Here I'm using this is a composite polisher from Venus. It's a Venus Supra composite polisher just to remove any areas of roughness, especially if you made adjustments to the occlusion. This high polishing cup polisher is from the Bruxer polishing kit. So you can use that on there as well. And so this is immediately after delivery. The restoration, I have to say, it's held up really well. I think we're at a 3-year service. We like to bring our patient in routinely just to kind of do a little follow-up. It is opposing a Bruxer as well, so it is interesting to just track the amount of wear on each. But so far, smooth against smooth is what we want. You know, smooth surface. It's not so much the hardness of the material. Smooth on smooth is our happy place. So I know we're at time, so I'm going to go ahead and just check in with Leia to see if there are any questions. This was another endo case, but maybe we'll review this next time or at a future date.
All right, Dr. Chi, first question, will curing Scotch bond create micro leakage?
Good question. Does curing Scotch bond create micro leakage? It shouldn't. Technically, most of the studies that I've seen are in favor of polymerizing the bonding agent. I think there's a little bit higher bond strength, but as far as leakage, I suppose it's possible if you have excess bonding agent, maybe the strength of the bonding agent is not so strong in a certain area and you have it pooling in a certain zone. But that's something I'll have to look a little bit more into. Not to my knowledge, but just thinking maybe in excess, there's a possibility. Good question.
And while we're on the topic of bonding, what is the bonding protocol for Bruxer?
Yeah, the bonding protocol for Bruxer, it's pretty close to CAMouflage. So you do want to sandblast the material. And just for it, when it comes to bonding for all materials, it's about surface area. We etch surfaces, we air abrade surfaces to increase surface area. And that just gives surface area more more surface for our chemicals to kind of come into contact with, more surface for the integration of the resin monomers and bonding agent to kind of interlock and create that micromechanical retention. So air abrading the Bruxer surface is how we roughen the surface. There's some in really challenging situations where I think, gosh, even this is kind of limited surface area. I'll take a coarse diamond before I sandblast and just kind of roughen, score the surface. And those channels, at least in my mind, this should be studied probably. Uh, and I've made that suggestion to our R&D department, so hopefully we get to look at it at some point. But I roughen the surface with the burr. Of course, there's downsides of doing that too aggressively as well, but I roughen it, see these visible channels, and then I'll air abrade over that. So that's kind of an additional in my mind. And I've had pretty good success there. Knock on wood, no failures, no debonds in those situations. But air abrade the surface, and you want to air abrade like we saw here after try-in. Because the air abrasion not only will roughen the surface, but you also want to clean the surface. The saliva will contaminate the Bruxer material and inhibit the bonding. After you have a air abraded, clean Bruxer surface, then you're going to need to apply a phosphate primer, a zirconia primer, a product like Z Prime, Monobond Plus. I think Curare Ceramic Primer Plus is also a good one. But just make sure it has something for zirconia priming, which usually entails an MDP or phosphate type primer. Once that is applied, that is essentially how you pre-treat zirconia for bonding. The rest of it, the tooth side can be the same, your preference, total etch, self-etch, or yeah, that's basically it. Total etch, self-etch, and tooth side, again, that's kind of up to you. But the really key thing is air abrasion, clean zirconia, and phosphate primer.
And the last question is, in crossbite situations, how would you set the occlusion?
Uh, yeah, good question. So crossbite situation. So crossbite would basically entail the reverse cusp positions. So now that would create the lingual cusp that would probably be in the central fossa of the opposing. So I would actually try to design them similar to the way the buccal cusps are. Notice how the buccal cusps are usually a little bit more rounded, so that way it adapts into the central fossa. You basically want for it would be the lingual cusp going into the middle here, right? So you want them to be a little bit rounder, not too sharp, just to have more crushing ability. And then I'm sorry, I keep turning on the wrong thing. So that would be the lingual cusp into the central fossa, and then the buccal cusp would be hanging out. Those would be kind of the non-functional teeth. So I would keep those a little bit lower, out of any lateral pathway, lateral excursive pathways that might bump into those zones and kind of risk pushing that restoration laterally, or having those tensile tension forces on the restoration. Good question. Thank you.
And that is all the questions that we have. Thank you so much, everybody, for joining. And please be on the lookout for next month's office hours with Dr. Chi. Thank you, Dr. Chi, and everybody, have a great weekend.
My pleasure. Thanks for tuning in. Have a great weekend.